Hi, this is Dana Ranahan of Bodywork Sports Physiotherapy in North Vancouver, and I'm here today with a patient, Donna, and she's had a fracture to her wrist, and we're looking at how we get her wrist moving again and how we help to alleviate some pain. So today I just wanted to go through a brief little look at how we would assess her wrist and work on getting it moving again. So Donna was in and we've done some work to get it moving, but basically she had some fracture and a little bit of swelling through her wrist here and some restriction in mobility. So what we want to look at is, how does Donna's wrist move when we look at the palm coming up and down? So wrist extension we would call that, and wrist flexion as it comes down. And we would look at it in different positions as well. Sometimes we would say, well, let's look at it where the hand's facing in towards the tummy. That's a very functional position for the wrist. And also, what about when the hand's up? Now in Donna's case, she's a little bit stiff in her forearm when we look at trying to turn the wrist up. So that's another thing we need to assess. She does well with her palm down, but gets stiff on the palm up. And then the wrist can't function very well because it's a bit jammed up higher in through here. So what we would do is usually I lie down and do some assessment through her wrist to say, well, how are the bones moving in space? How is the joint moving? And if we want to look at mobility through here, we can assess more specifically what's happening with the joint mobility in Donna's wrist. You can just relax your arm, Donna, don't have to help. Yeah, that's easier. So we can say some of these are moving. She's a little bit of stiffness in through here. Then we may want to do some mobilizing to help her move. But we know part of Donna's restriction comes with this turning up position. Otherwise, she likes to use her upper arm to help. So we want to try to encourage some mobility here. So with Donna, some of the things we've worked on are trying to restore movement where she's stiff, and then we give her some exercises to help her maintain that at home and work on strength. If you have any other questions, give us a call at 604-983-6616. Thanks.